Okay. We will start now.
Mm-hmm.
Okay. So we finished the cases already. We'll continue to the quiz. Okay. Bismillah.
Bismillahirrahmanirrahim.
23. Your hospital case management program monitors length of stay or the LOS. Am I clear to you, Radha?
Yeah.
Okay. By condition, LOS for 4 conditions has decreased slightly each of the last 6 quarters. To evaluate cost and quality of care impact, you recommend which measures. The question is asking you to determine what metrics or measures should be used to evaluate the effects of slight reduction in the length of stay for patients in a hospital. Okay, for letter A, denials, comparison with previous 2 years, length of stay, and readmissions. Letter B, staff productivity changes, reimbursement, length of stay at next level of care. C, reimbursement, comparison with conditions with increasing length of stay and denials. And letter D, outcome of transition plan, reimbursement, and readmissions. What do you think is the answer?
Maybe D.
Yes, it is letter D. To evaluate the cost and quality of care impact, decreasing the length of stay. So this is the following measures that I will give you are crucial. The outcome of the transition plan, because this ensures the patients are discharged appropriately with a plan that meets their post-discharge needs, reducing the risk of the adverse events or complications. What about for the reimbursement? This tracks the financial complications to determine whether the short LOS impacts revenue positive, either positive or negative. For the readmissions, this measures the effectiveness of care and discharge processes as high readmission rates often indicate poor care quality or inadequate discharge planning. While the other three are incorrect for the letter A, because readmissions, since readmission is also relevant, but denials and historical length of stay comparison do not provide the direct insights into the impact of reducing the length of stay on cost and quality. For letter B, this one is also incorrect because staff productivity and LOS at the next level of care are not as directly tied to evaluate the overall cost quality of reduced LOS. Well, for letter C, this one is also incorrect because comparing with the conditions with the increasing LOS and denials does not focus on the patient outcomes or care quality. The correct answer is letter D. Okay, move on. Number 24. In revising the utilization management or the plan, which of the following is most important to consider? A, external contract requirements. B, accreditation survey results impacting C, performance measure results. And D, clinical pathway length of stay variances. What's the answer?
C.
It's letter
C.
B? No.
C.
Boy. Okay, the correct answer here is letter C. These metrics or measures provide
High
an
performance measure.
objective data on how well the utilization management program is meeting its goal, such as reducing unnecessary care, improving efficiency, and maintaining quality. While for the three, for letter A, they serve as guidelines. So the plan itself should be revised based on internal performance and outcomes, not only the external requirements. For letter B, this is also incorrect because accreditation results are periodic and provide general recommendations. They are not as critical as the real-time performance data when revising the utilization management plan. For letter D also, this is incorrect because LOS variances are a specific aspect of and do not encompass the full scope of the plan. So this is the letter C is the correct answer. Remember, okay? Number 25. In your organization, quality management and risk management are separate departments. As quality management director, you recognize the importance of linking with the risk management to provide or reduce risk and maximize patient safety. Use this information to answer question. How can quality management link with the risk management on peer review cases? A. Provide information about peer actions. B. Provide information about patient occurrences. C. Provide aggregate occurrence data. D. Meet the RM director regularly in confidence. What's your
B. Provide information about patient occurrence.
why?
Peer review can find out the occurrences, patient occurrences,
Mm-hmm. Okay.
and
Yes. Okay. The correct answer here is letter C. Provide
three
aggregate.
aggregate occurrence data.
Yes, the reason is linking the two, the quality management with the risk management on peer review cases. This involves the sharing aggregates occurrence data, which provides the trends and patterns of adverse events or quality issues. This also allows both departments, the QM and RM, to identify systemic risk, address root causes, and implement strategies to improve patient safety and reduce the risk across the organization. When we say aggregate data, this ensures the confidentiality while offering actionable insights for collaboration. So letter C is the answer.
Okay.
Okay. Why letter A and B are incorrect? For letter A rather. This is incorrect because sharing detailed peer review actions may breach the confidentiality agreements. Okay? While for
Okay.
letter D, this is also incorrect because sharing individual patient occurrences may not provide a comprehensive view for addressing systemic issue and could violate the privacy standards. For letter D, this is also incorrect. They are not the primary way to share actionable data for linking quality management and the risk management efforts. Okay? For number 26. In your organization, quality management and risk management are separate departments. As quality management director, you recognize the importance of linking with risk management to prevent or reduce risk and maximize patient safety. Use this information to answer questions. One of the following, sharing which data best supports the risk prevention. Letter A, annual practitioner profiling. B, monthly event occurrence reporting. C, root cause analysis. D, FEMIA or the failure mode and effect analysis.
FMEA.
Okay.
Sorry.
Okay. So we have, hi, Dr. Gulam. Good
Hello,
evening.
good evening.
Welcome.
Thank you.
Okay. So what's your answer, Radha?
FMEA.
Yes, that's the correct answer. FEMIA, because it is a proactive risk prevention tool that identifies potential process failures and their effects before they occur. For letter A, because profiling evaluates individual performance trends over time and it is retrospective, not proactive, preventing risk. For letter B, reporting is a reactive. Okay, this is when we say occurrence reporting or the OVR. This is, or
Not
RCA.
proactive.
I'm sorry, OVR. RCA, it is a reactive process that identifies events after they occur, focusing on addressing existing issues rather than preventing future risk. For the RCA, okay, same goes with letter B and C. RCA investigates the causes of adverse events after they happen. While while useful for the improvement, but it is not a tool for proactive risk prevention like the FIMIA. Okay, the answer is letter D. 27. In your organization, quality management and risk management are separate departments. As quality management director, you recognize the importance of linking with risk management to prevent or reduce risk and maximize patient safety. Use this information to answer question one of the three aspects of quality discussed in Chapter 1 concerns perceptive quality, the perspective of the recipient or observer of care. Of the following options, how might this aspect of quality best be utilized in linking the quality management and risk management goals? For letter A, involve the patient in ideas to improve safety. B, teach the patient self-care. C, involve the physician in ideas to improve safety. D, teach the staff effective hand washing.
1. Involve the patient in ideas to improve safety.
Very good. This is a perceptive quality focuses on the patient's perspective and their experience of care. Very good. Why not letter B? Because this teaching self-care focuses on empowering the patient in managing their condition, which is important but does not directly link the quality management and the risk management goals focused on safety and systemic improvements. Why not letter C? Because physician involvement is also important, but the question emphasizes about perceptive quality, which is specifically from the patient's perspective and not the physician's. While for letter D, hand washing is crucial for safety, right? So it is a standard safety measure that does not address the patient's perspective or their involvement in improving safety. So the best answer here is letter A. Okay. 28. Comprehensive Health Integrated Delivery System, or IDS, consisted of 4 acute care hospitals, a behavioral health center, 2 long-term care facilities, and an ambulatory surgery center. 1 year ago, after cost-benefit analysis, the IDS added a home health agency with investments in a building, staff, marketing, computer system, and other equipment and materials. Tracking expenses and revenue over time, when would you expect a return on investment or the ROI? The question here is asking you to predict when the investment in a home health care or agency within an integrated delivery system, or the IDS, might start generating a return on investment, or the ROI. Okay, so letter A, after 2 years. B, at the break-even point. C, when revenue consistently exceeds expenses. Letter D, when patients consistently use agency services. What's the best answer? Dr. Gulam?
Actually, if it says once the break-even point, it is actually balanced. So now,
Yes.
after that, the revenue consistently exceeding the expenses, that is the time when the profit is starting. So it seems in my view, it is C.
Very good. That's the correct answer. A return on investment is realized when revenue consistently exceeds expenses, as this indicates that the organization is generating profits after covering its costs. Yes, you got the point, Dr. Gulam. So in this scenario, the investments made in the home health agency, like the building staff, marketing equipment, will start contributing positively to the organization's financial performance only when revenue surpasses the ongoing and initial expenses. It is not after 2 years, because the time frame for achieving the ROI varies depending on multiple factors, including the patient volume, market conditions, and operational efficiency. ROI cannot be guaranteed within a specific period. Why not at the break even point? Because this represents the stage when revenue equals expenses, meaning there is no profit yet. The ROI occurs only after surpassing the break point and generating consistent profit. For letter D, this is incorrect, because patient usage does not necessarily indicate profitability. Expenses may still exceed revenue depending on operating costs and the reimbursement rates. So the answer here is letter
C.
C. Okay. Number 29, most commonly the primary purpose for incident or occurrence reporting is to A, record infection rates, B, identify medication errors, C, identify adverse patient events, D, identify patient grievances.
Identify patients' adverse events.
Yes, very good. Okay, it's letter C.
C.
Identify adverse patient events, because the primary purpose of the incident or occurrence reporting is to identify adverse patient events, which include any unintended harm to a patient as a result of medical care or services provided. Okay, let's proceed. Number 30. At Sunshine Community Medical Center, occurrence forms are sent directly to the risk manager, who summarizes the data and submits quarterly reports of the prior quarter's data to administration and the governing body. Use this information to answer question. Why might this process be considered inadequate based on project improvement process principles? A, the process does not include priorities for data collection. B, the report does not include data collection tools. C, the report does not include claims information. D, the process does not trend the data over time. What's the correct answer? It's letter D. Okay.
D. Mm.
Dog. It's letter D, dog. The process does not trend the data over time. One of the core principles of the project improvement is the ability to analyze the trends over time by identifying, I'm sorry, it's performance improvement rather, sorry. Performance improvement is the ability to analyze the trends over time. By identifying patterns, organizations can better understand the causes of recurring issues and develop effective interventions. Why not letter A? The description does not suggest that data collection priorities are missing. Occurrence reporting inherently focuses on events of concern. Letter B is incorrect also, because data collection tools like the occurrence forms are being used in this process. So this is not a limitation. For letter C, the claims information is typically used for financial and legal purposes, not directly tied to the performance improvement process. Okay, so the letter D is the correct answer. For 31, over the last few months, the organization has experienced several adverse events concerning trips and falls on the grounds outside, although without serious injury to date. Use this information to answer question. What can the quality professional do to best facilitate risk reduction? A, coordinate a failure mode and effects analysis. B, coordinate a root cause analysis. C, recommend new lighting for the areas involved. D, research the events to identify a pattern.
Coordinate a root cause.
Okay, why?
Minute.
Retros.
What's the correct answer?
Yeah, it's a root cause analysis because already they have several
Several
adverse
adverse
events.
events occur which cause patient fall. So what will be
Okay.
the cause behind it?
Concerning trips and falls on the grounds outside, although without serious injury to date, over the last few months. Okay. The best answer here is letter A, coordinate a Phm analysis. Why? It is a proactive approach to identify potential failures in a system and their possible effects before an adverse event occurs. Does that make sense?
There is a lot of falls on the ground outside is written.
But coordinating a failure of Phm analysis before, since it is a proactive approach. So at least you could
Before a
have
serious injury occurs.
identify any potential failures. So because since these trips and falls have not yet resulted in serious,
Severe
look at
harm.
here, look at here in the without serious injury to date. So since these trips and falls have not yet resulted in serious injury, conducting a FEMA helps identify vulnerabilities in the outdoor environment and implement preventive measures to reduce the risk of future incidents. Okay, so this is the most effective method for facilitating risk reduction in this scenario. Okay, so the answer here is letter A, FEMA. Why not letter B?
That's what my question. Why not better B?
I
Because
will.
this patient is
Because
having
before
several.
getting the serious injury to the person, so we
Okay.
can provide
This
maybe.
okay. This is incorrect. RCA is a reactive. We know this one. It is a reactive.
Okay.
Ma'am, this is used to investigate the root cause of a specific adverse event that has already occurred. While it is also useful, but RCA is not appropriate here since no serious injuries have occurred yet. And thus, a proactive approach is more preferred than letter B.
If a serious injury occurred, that could be a sentinel event.
Yes.
So then the sentinel event RCA is mandatory there. But here, several adverse events, which may be or may not be a sentinel event, how we can differentiate between sentinel event and adverse event here?
Okay. Can we just get over again to the question here? Over the last few months, the organization has experienced several adverse events concerning the trips and falls on the grounds outside. Although, so the keywords here is the several adverse events and the falls on the grounds outside. But in here another word is without a serious injury to date.
Yeah.
Okay, do you both get my point here?
Yeah.
Because what can the quality professional do to best facilitate the risk reduction? The risk reduction. And the most effective method for this, facilitating the risk reduction, is to conduct the FEMA, coordinate a FEMA analysis to prevent more of this injury to date.
Yeah, no.
Is it clear?
Yeah, it's clear.
Hopefully. Okay, Radha, what about
Yes,
you?
yes, I'm clear.
Okay, that's good. Okay, for number 32. Over the last few months, the organization has experienced several adverse events concerning trips and falls in the grounds outside. Although without serious injury to date, use this information to answer questions. Which of the following offers the best rationale for the quality professionals' involvement in this situation? Letter A, successful pre-work improves team efficiency. B, successful proactive improvement. Activities improve processes. C, successful improvement activities reduce cost. And letter D, successful reactive improvement activities minimize recurrence, or the RCA. What's the answer?
B.
Yes, it's letter B. Okay. In this situation, the focus should be more on the proactive improvement. Yes, that can prevent future incidents and enhance safety processes. Why not letter A? Because the focus in this scenario is on addressing the safety issues, not on team efficiency, which is not the primary concern for this question. Why not letter C? Because the cost reduction might be a secondary benefit, yes, but the primary goal here is process involvement, or yes, to enhance the safety and reduce the risk. For the letter D, this is also incorrect because reactive improvements such as this RCA are conducted after the adverse events. And this situation calls for proactive measures since the incidents have not yet resulted in serious injury. Actually, this also interrelated to the previous question. So it is more on the proactive approach. Okay. Is it clear now?
Yeah.
Dr. Gulam,
Yeah.
any doubts?
No,
Mhm.
because this is
Oh,
clear with this, but there is no serious injury. And the serious injury means until an event RCA is mandatory. But here there is no
yes.
serious injury. So with this is actually they want to make bit confusion there. Serious
Mhm.
injury, but without serious injury, and that is a
Ye-
mix of the word which they want to make it a bit confusion. But once we are our proactive and reactive, if we are
Mhm.
sure, I think we can differentiate between these two things,
Okay,
FEMIA
very
and
good.
RCA. Yeah.
Very good. Okay. So let's proceed. Number 33, one of the best ways for a patient safety program to be effective is to provide anonymity. Letter A, root cause analysis. B, individual case review. C, occurrence or incident report. D, decision making.
The occurrence incident reporting.
Okay, letter C is the correct answer. Because for a patient safety program to be effective, it is crucial to ensure anonymity in occurrence incident reporting because this encourages the healthcare staff to report errors, near misses, and adverse events without fear of blame or retribution. Anonymous reporting fosters a culture of openness and trust, which is essential for identifying risks and implementing system-wide improvements to enhance the patient safety. For letter A, incorrect, because anonymity is not typically a priority in RCA. RCA often involves a team reviewing specific events and identifying contributors. For letter B, because case reviews usually require identifying individuals and events to understand specific circumstances and actions. For decision making, this processes in patient safety programs, this involves accountability and collaboration rather than anonymity. So the best answer is occurrence or incident reporting. Okay, number 34. In a cost effective analysis of a bar code medication administration system implemented as part of a patient safety program, which of the following would be the best indicator of success? Letter A decrease in adverse drug events from dispensing errors. B, a decrease in adverse drug events from administering errors. C, a decrease in total medication errors. D, a decrease in total adverse drug events.
A decrease in total medication errors.
Okay. Dr. Gulam, your answer?
Actually, here the barcode medication administration system being implemented. So,
Yes.
if that is the reason why the best indicator of success is adverse drug events from administering errors. This is my answer. B.
Letter B.
Yeah.
The answer is letter D, dog. A decrease in total adverse drug events. The best indicator of success for a barcode medication administration system is a decrease in total adverse drug events or the ADEs. The system is designed to reduce medication errors at multiple points in the medication administration process, including prescribing, dispensing, and administering. Measuring the overall reduction in ADEs provides a comprehensive view of the system's effectiveness in improving patient safety. Why not letter A? Because focusing only on dispensing errors is too narrow. The system is designed to address errors across the entire medication process, not just dispensing. Letter B. Administering errors are a key focus. Evaluating the system's success requires considering its impact on all types of medication errors.
But
Well, letter
being a direct, 1 minute, sorry to interrupt.
yes.
Because beyond when we are in the frontliners, when
Mm,
our nurses administer the medication by
yes.
using the barcode.
Yes.
Yeah, when they are using the barcode, this is the adverse drug given from administering errors. This is, mainly we focus on the administering error, but all these been issued from the pharmacy, IV pharmacy, other pharmacy. Always they issue the drugs, but unless until the barcode matches, we cannot administer. This is for
Administer.
frontliners.
Yes.
So this is, in my view, because I'm daily in and out, I'm seeing my patients, my nurses.
Yes.
So
Okay, doc.
the administering error is to avoid administering errors is my point of view. But maybe I'm not. I'm wrong.
Mm-hmm.
Yeah.
Okay.
Because it
Hello, doc.
cannot be total. It cannot be a total one. Because total I cannot expect. Because the barcode we have to match. Then only we administer. My nurse will administer only after the barcode is matched the medication.
Yes, we cannot administer. We cannot even dispense because it will give an alarm, a warning alarm. Okay, because the question here, Doc, is which of the following would be the best indicator of success?
Total is a general term. I cannot say total. I cannot accept total. It's a general and vague term. But administration is a specific term, which can be. This is what I feel because when we are doing such type of questions, and barcode is a specific term, and total is a generic term. So when matching, when you have a two specific and general terms, the answer should be very specific. This was my conception. I don't know whether I am right or wrong.
Okay, because here, uh, the words here is a barcode medication administration system. So it is a system, doc. It is not only pertaining to one like the dispensing error, administering error, but as a system. Okay, so when we talk about the system, is to reduce of all these medication errors that includes administration process, like the prescribing, dispensing, and administering. We are talking about the system, not the specific of what kind of or the indicator of success, but as a whole, as a system. So the system, like I said, including the dispensing, administering, and the process of the medication administration. So this
So
is
why it is not a decrease in total medication errors? Why only in adverse drug events?
why, I'm sorry, not the total medication errors.
It
Because
can be prevented with, dispensing, administering, transcribing, whatever, prescribing,
yes.
whatever it is, totally it's coming.
So a decrease in total medication error is also incorrect because not all medication errors, not all the medication errors lead to adverse drug events.
Drug events.
The ultimate goal of the system, like what I said, is to reduce the harm that is measured by the
Sorry to interrupt.
not
Just
just
my
errors.
principle.
Okay,
Sorry, I don't
doc.
want to spend much time on this same question.
Okay,
but the
doc.
question is,
Yes.
yeah, actually, the medicine dispensing either in the form of tablets or IV fusions, infusions, but specifically barcode is used for the mainly Lassa or the step of course, the step of medications.
Yeah.
So that's the reason why because to avoid the administering errors rather than prescribing dispensing total. So this is the why specifically I feel administering error for especially like a heparin or other drugs,
The harm.
high
Okay.
electrolytes, the harm producing or Lassa. So these are the things what it could be, but I think I have to refer this when I because even
No,
single
as per
question.
the policy, each medication has to be barcoded, right? Not only
Yes.
Yes. You're all correct. Actually, I got your point also. But because can we just stick to what the question is
Next.
indicating here
Yeah.
and asking? Because it is about the barcode medication administration system that it has a goal to to reduce the harm to the patient. So we'll just focus what is the system is all about.
Yeah.
What the system all about. Okay, we will not when you read this one in the question in the exam, just not to focus on of one of this, the dispensing errors of one of the elements of the system. So because it is about all the process of the medication administration. So just the key word here is the indicator of success. So meaning to decrease the total adverse drug events. Okay, I hope this.
Yeah, it's fine.
Yeah. I hope you understand also the rationale behind this answer.
Yes.
Okay, so please bear with me, and I
No,
hope
it's fine. No. Just because otherwise, Alhamdulillah, it's fine.
yeah, we
Good.
are all entitled of our own opinion, and I'm really glad that you are all participating and interacting with me. And this is exchange of ideas actually. Okay, so the best answer here is decrease in, where am I now?
Adverse
Adverse drug
outcome.
events. Sorry. Okay. So that's the answer. Okay.
Yeah.
Can we move on now?
Yeah.
Okay, thank you. Number 35, a patient using a large exercise ball in outpatient rehabilitation fractures 3 ribs. When the ball bursts and she falls onto the floor, the risk manager tells the patient that all cost of care will be covered. Of the following, this action best represents risk: A, avoidance of prevention; the assessment or analysis; C, transfer or shifting; D, handling or intervention, or the risk reduction.
Answer
What's
or
the answer?
or shifting.
The risk manager tells the patient that all costs
Will be covered.
of care will be covered. Okay. The answer is letter dog.
C,
Handling or intervention. It is a risk reduction.
reduction.
In this situation, the risk manager's action of covering all costs of care represents handling or intervention, which is a form of risk reduction. By addressing the patient's needs immediately and ensuring financial coverages, the organization is taking steps to mitigate potential fallout such as legal claims, patient dissatisfaction, or reputational harm. For letter A, this is incorrect because prevention refers to actions taken to prevent the risk from occurring in the first place. Okay, letter B, this is also incorrect because assessment or analysis involves identifying and evaluating risk which occurs prior to implementing risk management strategies. C, the transfer or shifting typically involves passing the financial or operational responsibility for the risk to another party, such as insurance. In this case, the organization directly assumes responsibility for the cost. So the best answer here is handling or intervention. Okay, number 36. Occurrence or event reporting is an example of A, peer review; B, root cause analysis; C, generic screening; D, special study. Any answer?
Peer review.
Doc Gulam?
Mm,
Occurrence or event reporting is an example of.
Generic screening.
Yes, very good. It is a method used in occurrence or
Generic
event
screening.
reporting is a method in generic screening where reports or incidents or events are collected to identify potential risk trends or adverse outcomes. It serves as an initial step in identifying issues that may require further investigation or corrective action to improve the safety and quality. Why not peer review? Because this involves evaluating the performance or decisions of healthcare professionals, typically by their colleagues. Letter B, it is a detailed, the root cause analysis, a reactive investigation conducted after a significant adverse event to identify underlying causes. Why not letter D, special study? Because studies are targeted analysis focused on specific issues, often designed to test hypotheses or evaluate the outcomes. So the answer is for number 36 is letter C, generic screening. 37, okay, The primary purpose of genetic screening is to A, identify adverse occurrences as early as possible. B, provide data for practitioner reappraisal. C, identify common cause variation. D, trend occurrence data over time. What's the answer?
A.
Yes, letter A is the correct answer. It is to identify adverse occurrences or potential risks as early as possible. For letter B, because genetic screening focuses on identifying events or patterns, not specifically on data, on individual practitioner performance. Letter C, because common cause variation refers to inherent system variations, typically identified through statistical process control, not the genetic screening. Why not letter D? While trending data is a valuable outcome, it is not the primary purpose of genetic screening. The focus is on early detection. Okay, so number 37 is letter letter A, identify occurrence as early as possible. For 38, risk management in an organization is most effective when it is A, responsible for sentinel event root cause analysis, B, incorporated into organization-wide safety management, C, integrated with organization-wide performance improvement, D, the responsibility of the clinical performance improvement team. What's the best answer? Risk management
Integrated with the
is most effective when it is letter
Y. P.
yes, it's letter C. Risk management is the most effective when it is integrated into organization-wide performance improvement, because this ensures the risk management efforts align with the organization's broader goals for quality, safety, and efficiency. Why not letter A? Because this may participate this may participate in the RCA for sentinel events. Its effectiveness is not limited to this function because it needs to address all organizational risk comprehensively. For letter B, this focusing solely on the safety management narrows the scope.
Only safety.
Okay, yes. Risk management should encompass all aspects of performance, including financial, operational, and all clinical risks. Excuse. For letter D, this is also incorrect because limiting the risk management to
Clinical
clinical
performance.
teams neglects its applicability to other areas like finance, administration, and facility operations. Okay, letter C is the correct answer. 39, root cause analysis is the most appropriate PI process for A, determining cost benefits, B, evaluating dental care, C, analyzing sentinel events, D, performing peer review. RCA is the most appropriate PI process for
Determining cost and benefits or analyzing sentinel event. No.
Yes, that's the answer. Letter C, analyzing sentinel events. RCA is a systemic process used to identify the underlying causes of sentinel events, like the unexpected incidents that result in death or serious physical or psychological injury. The goal of RCA is to prevent recurrence by addressing systemic issues rather than assigning blame to individuals. For letter A, this is incorrect. Cost-benefit analysis focuses on evaluating the financial implications and outcomes of actions, while letter B, it is not specifically tied to evaluating dental care or any specific service area unless a sentinel event occurs in that domain. For letter D, this is also incorrect because this focuses on assessing individual or group performance. Okay, for number 40. Failure mode and effect analysis FIMIA is what type of review or improvement tool? Okay. We have A, concurrent, B, focus, C, prospective, D, retrospective.
Prospective.
Very good. Yes, it is always prospective. Okay. Okay, population health cases. Number 1, Might a healthcare system address social determinants of health in an effort to improve outcome of care? Letter A, implement smoking cessation education for asthmatic patients. B, offer transportation services for patients over 65 ages. C, reduce medication co-pays for low-income patients. D, provide the same interventions regardless of the patient income level.
Yes, last one. D.
Yeah, letter D, because this is correct. This reflects the principle of healthcare equality rather than differentiation based on the socioeconomic status. This ensures that all patients, regardless of their income, receive the high quality interventions and opportunities to improve their health outcomes. Okay, so that's the best answer. While addressing the social determinants, like in option A and B and C, are also important, but letter D ensures the uniformity of care, which is a key step toward building trust and equity in healthcare system. It avoids potential gaps in care that might arise from targeting only specific groups. Okay. Number two, one of the reasons collaborations with stakeholders is critical to improve population health through health policy development is because A, decision makers will be able to distribute resources with fairness and equity. B, it will level set the expectations of compliance for all stakeholders involved. C, the outcome of the health policy will directly impact on individuals' behavior. D, it often includes legislations as well as a public-private partnership. So the answer is
Yeah.
letter A, because collaboration with the stakeholders
Population
ensures
health.
that diverse perspectives are considered, enabling the equitable distribution of resources to address population health needs effectively. Stakeholders' involvement, this allows policies to be more inclusive and fair, addressing disparities and promoting better health outcomes for all. Letter B, while stakeholder collaboration may promote compliance, but it's not the primary reason for collaboration in the health policy development. For letter C, this focuses on the effects of policy, not the reason for stakeholder collaboration. For letter D, well, true in some cases, but this is not the primary reason for collaboration with stakeholders in health policy development. So the best answer is letter A. Okay, number three, accountable care organizations utilize or what we call the hot spotting as population health tool is A, identify and focus resources on high cost chronically ill patients. B, provide education to chronically ill patients on diet and weight management. C, increase communication with care providers in areas with high number of Medicaid patients. D, provide follow-up for private insurance. What's the best answer? Okay, it's given here. It's letter A. Hot spotting in population health management. This refers to identifying specific geographic areas or patient populations with high healthcare costs and poor health outcomes. Accountable care organizations or the ACOs use this approach to allocate resources effectively and manage care for patients who require the most support, such as those with chronic illnesses. For letter B, this is wrong. It is also important part of the chronic illness management, but not specifically describe the purpose of the hot spotting. For letter C also, this addresses communication improvements, not the identification or resource focus central to hotspotting. Okay, for letter D, hotspotting is not specific to private insurance. Okay, so it applies broadly to identify and address only the high need populations. Okay, clear?
Yeah.
For number 4, the final report from a community readiness assessment is important when implementing a population health initiatives because it endorse interventions that are supported by the community. B, identifies unique issues to target within the community. C, covers a wide array of topics to address in the community. D, demonstrate success of educational program within the community? So the answer here is
Identify
B. Yes, identifies unique issues. A
issues.
community readiness assessment is a critical step in implementing the population health initiatives. It helps to pinpoint specific issues, challenges, or needs within the community that require targeted interventions. Why not letter A? Because while gaining the community support is important, but the assessment's primary goal is to identify specific issues, not to endorse interventions. For letter C, the assessment focuses on identifying key issues, not covering a broad range of topics. While for letter D, demonstrate success of educational program within the community, this relates more to program evaluation after implementation, not the readiness assessment itself. Okay, so that ends now the topic. So we will proceed to